Hello.
السلام
I'm
عليكم.
Dr.
ده لون wait please. السلام عليكم. ده لون clinical consultation day. First scenario. Mrs. Samia, 39 years old, present to the fatigue. Please take history, examine her, and address her concern. Yes, here you go. You can start now, Dr. Mia.
Hello,
Hello.
I'm Dr. Akbar. I'm one of the doctors in the clinic today. May I confirm that you are Miss Samia, 39 years old?
Yes.
Miss Samia, I'm here to discuss regarding your health condition. For that, I'll be taking your history and doing your examination. Is it fine with you?
Okay.
Okay, can you tell me that what has brought you in the clinic today?
Actually, since long time, around like 8 to 9 months, I start to feel tired most of the time. I feel tired even with just doing anything simple, and it
Okay.
become worse even day by day.
So, may I know that is it the first time you are experiencing this problem in 9 months, or something previous happened as well?
Actually, this continuous feeling tiredness, it's my first time to feel like this. Before, yeah, we have
Okay.
some simple tiredness, but not like this.
Okay, not like this. So may I know that your tiredness, like in any particular time of the day, in the morning, at the end of the day, or whole day, if you want to tell.
Actually, it's most of day, but I notice also at the morning, at the daytime, I feel also like sleepiness most of the day.
Mm-hmm. Okay. So may I know that have you noticed any weight changes?
Yes,
Okay, like what changes? Is it increase,
uh,
decrease,
increase actually.
increase? Like how
Yes,
much? In how many months?
actually, I didn't check it, but I noticed that my clothes become tighter, my rings become smaller, and like this, my shoes, I need bigger size now.
Okay. Okay. And have you noticed any change in your facial features as well?
Yeah, actually, most of them say there is some features like changes in my face, become like a little
Okay.
bit bigger.
Okay. Any rise in body temperature you have noticed?
Not like body temperature, but I feel that I'm hot, especially my feet, my hands. It's like hot,
Okay.
not that temperature high.
Okay. Any weather preferences?
What?
Weather preferences?
What? Sorry.
Any weather preferences, like you prefer hot or cold? Weather
Ha
preferences.
ha ha. No, no, not actually. I didn't notice any
Okay.
change.
Any lumps and bumps in any part of your body?
I didn't notice that.
Okay. How's your appetite?
It's the usual, no change.
Okay. How's your mood these days? Do you feel depressed? Anything like that?
Yeah, a little bit. I feel like I have
Okay.
a little bit less mood.
Okay. Have you noticed any headaches?
Yes.
Okay. Like what kind of a headache? Like it's dull, sharp. Can you define it?
Yeah, I feel it like it's dull and it's all over my head and it
Hmm.
most of the day, but it increased mainly at the early morning while I'm waking from sleeping. I
Okay,
feel
in the
that I
morning.
have headache.
Okay,
Yes.
have you noticed any vision changes like blurring, bumping into object, doubles?
Yeah, I feel like my vision became hazy like this, mostly at the maybe 5 6 months,
Okay, have you
and
bumped
it's
ever
increased.
to
What? Sorry.
any bumping into objects or difficulty in parking the car? Have you noticed
Ye-
this?
Yeah, actually, the sights.
Okay,
I
okay,
feel that I.
okay. Okay, have you noticed like any problem in your sleep that you feel anyone notice you snore when you sleep?
y- Yeah, actually, while I'm sleeping at night, my husband
Mm-hmm.
noticed that I have snoring.
Okay, and do you feel like when you wake up in the morning, like your mood is dull and the concentration is decreased and
Yeah, with this
sleepiness?
tired. Yeah, most of the
Oh,
day I have just fallen in sleep like this.
okay, any abnormal shakiness in any part of your body?
No sickness,
Any weakness in any part of your body?
no weakness.
Any numbness and tingling, specifically in your hands, legs?
Actually, yeah, my right
Hmm.
hand feel like I have like this numbness sensation in this hand.
Okay. Have you noticed any itching in any part of your body?
No,
Any tummy discomfort?
No,
Any bowel changes like hard or loose? Any blood? Any color change?
no, nothing.
Any problem in your waterworks? Spike, increase or decrease?
N-
Any color
No,
change? Any gravel?
no, no.
Have you noticed any difficulty in intimacy with your partner? Sorry to ask you, it's personal.
Yeah, actually, yeah, with some difficulties also, abnormality in my period also.
Okay, I'll come to it. Have you
Okay,
noticed any discharge from your breast?
no,
Okay, any dryness in your private parts?
no,
Okay, any chest pain?
no chest pain,
Any cough?
no cough,
Any tracing and pacing of your heart?
no.
Okay, any joint pain?
Yeah, I feel that my left knee joint become a little bit painful when while I'm walking or just standing,
Okay,
and
so do you? Okay, okay.
it's relieved somehow by sitting, by sleeping. But while I'm walking or standing, I feel it increase in pain.
Okay. Is there any long-term illnesses you would like to tell me?
About what?
Any conditions like any high blood pressure, high sugars, any thyroid problem, any long-term
No,
illnesses? Okay.
no,
Any
no.
medications you have been taking? Show me your medications.
Nothing exactly, just like paracetamol for that headaches and some
Okay.
vitamins. And that's all.
Okay. Any over-the-counter medication, any herbal medications, anything else?
No, just I said paracetamol for headache and
Okay.
some vitamins.
Okay. May I ask you some personal questions?
Okay.
How are your periods?
Actually, it's not like before. It's now become just disappear for
Oh,
2.5 months and just came once and like this.
okay. And any chance you are taking any birth control pill?
No,
Any chance you are being pregnant?
no,
Any history of miscarriages?
no,
Do you smoke?
no.
What about alcohol?
Just
Mm.
social amount.
Sorry to ask you, any party drugs?
No, listen, drugs. No,
Okay. Any family history of similar illnesses?
no,
Any history of cancers in the family?
no.
Okay. May I know that you drive?
Yes.
So I would like to stop your driving right now as you have some difficulty in your vision till we find out what's happening with you. Is it fine with you?
Okay.
Okay. May I know, Miss Samia, how are the symptoms affecting your daily life?
Yeah, actually, it's my life now become more difficult. That I feel tiredness most of the day, and I fall in
Hmm.
sleep anytime, and it's
Hmm.
totally bothering me so much.
Okay. We'll try to take help from any occupational health worker as well. And may I know that what do you do for a living?
Uh, just housewife.
Okay. If we need it, we'll take help from social services as well. Is it fine with you?
Okay, thank you.
Okay. I would like to examine the patient.
Okay.
So I will see the patient from the bed end first to just look around and the general
Mm-hmm.
look of the patient, how she's looking right now. Then I would like to move to the right side of the bed. I will ask the
Okay.
patient to show me her hands. I would like
Okay.
to see the hand changes first from the nails for any clubbing, any signs of nail changes. Then I would like to check the shape of the nails, shape of the hands, any skin thickening, any skin pigmentation, any
It's
sweaty. Yes.
yeah, it's a sweaty hand, and also it's big and huge
Mhm.
hand with
Okay.
long fingers.
Okay. I would like to ask the patient to do the reverse prayer and prayer sign for the carpal tunnel syndrome.
It's painful, doctor.
Okay, so okay. Okay, all right. I would like to know the blood pressure and pulses of this patient if they are fine.
Yeah, BB is borderline 140 over 90, and pulse is normal.
Okay, I would like to offer for the proximal myopathy in the upper limb.
Okay, negative.
Okay, then I like to move to the face. I would like to check for the visual acuity in each eye. Then I would like to check for the visual fields in both eye.
Yeah, there is a bilateral bitemporal hemorrhagia.
Okay, then I would also like to do the H-shaped movements for 3, 4, 6 for any nystagmus, any double visions.
Negative.
Okay, I would just inspect this eyes for anemia jaundice. Any facial changes I will notice how she's looking, any large nose, any
Yeah.
prognosticism, and I would
Yes.
like to check
Positive.
okay, I would like to check the mouth of this patient for any gum hypertrophies, any pigmentation, any large tongue, and
Yes.
any spaces between the tooths. I would like to see all these things.
Yes. Positive.
Okay, I would like to offer for the neck circumference as well in this patient.
The what? Neck?
Neck circumference. Neck circumference.
For what you are looking?
For obstructive sleep apnea, I would like to check the neck circumference for OSA.
Okay, it's high.
Okay, and I would like to check the lymph nodes in the neck, anterior cervical and posterior cervical for any lymph nodes, for any mass
Negative.
for thyroid as well. Okay. Okay.
Negative.
Okay, I would like to auscultate the heart in two areas for any murmurs or any flow murmurs or any sound I can hear, specifically in the
Negative.
mitral. Okay, I would like to see the abdomen of this patient for any stria, skin changes, and for any visceromegalies.
Negative.
Okay, in the end, I would like to check the legs of this patient for any skin changes, any pedal edema.
Negative.
Okay,
Just
and
the large foot.
okay, okay, all right. And then I would like to offer the proximal myopathy in the lower limb as well.
Negative.
Okay, in the end, I would like to offer for the urine dip and a fundoscope in this patient and blood sugars.
Okay. Anything else you want to ask or to examine?
I have time.
1 minute before
Yes,
concern.
still 3 minutes.
Okay. Okay, if I have time, I'll check for the red reflex in the eyes as well, if it's present, the red reflex.
Okay, no need.
Okay, then if I have time, I just want to screen uh, the power in the upper limb or in the lower limb, if it's fine.
You know, actually, in the real exam, you will not examine in 3 minutes.
Yes, yeah. I know. That is why I can go on the concerns. It's fine.
Okay.
Okay. So, Ms. Samia, what are your concerns, please?
Yes, doctor. What do I have? This is very bothering me, and I want to know what is this.
Okay. So I understand your concern, and from the
2
history,
minutes left.
okay, thank you, sir. From the history and examination, it seems that it seems that you have a condition called as acromegaly. It's a condition where there is a gland in our brain we call it as master gland, and I believe that it producing a protein called in excess amount we called as growth hormone, and because of this excess protein, you are having these symptoms as well. And we like to do more tests in form of some blood test, some scans of your head as well, so that we can discuss further management plan with you. How that sounds to you?
Okay, doctor. Is this serious? Is it cancer?
Um, I understand your concerns, but cancer seems to be unlikely in your situation right now.
Will you admit me?
So, Ms. Samia, we will be making a team of doctors and we will admit you, and we'll see that you require any urgent surgeries or any medications. We'll plan that after your baseline test and we'll discuss further management plan with you.
Okay, thank you.
Thank you. Any other concerns for me?
No, thank you.
Okay.
You want to ask about any other history? Collect your thoughts. What could be the differential? Is it something tricky. If you are ready for the examiner question, we can move.
Okay, sir.
Yeah, Dr. Sarah, you can start.
Okay, doctor, can you present your case, please?
So I have examined this 39 years old female with a 9-month history of fatigue, which gradual in onset, and she's also having some constitutional symptoms of weight gain as well, and some low moods, headaches, morning headaches are with that as well, some problem in the vision as well, some intimacy issues as well, and she has some problem with the periods as well. Other than that, on examination, uh, there are some changes in the hand shape of this patient as well, and painful reverse prayer sign as well in this patient. Proximal myopathy in the upper and lower limb is positive with bitemporal hemianopia on visual fields. There is pragmatism as well. Other than that, patient has some changes in the foot shape as well, and that is it.
What's your differential diagnosis?
I would like to keep acromegaly as my first differential in this case.
Okay, what else?
I would like to keep prolectinoma as my second differential.
Okay.
And other than that, I would like to keep Cushing's can be one of the possibilities as well.
But against that, what?
But against that, there are no high blood pressures or no symptoms of diabetes or stria in the patient, so less likely. I would also like to keep obstructive sleep apnea as well in one of the differentials.
The obstructive sleep apnea as a complication or as a
Complica-
differential here?
as complications.
Okay, so what's the third differential?
Our third could be non-functioning pituitary adenoma. Would be one of the differentials.
Okay,
Or
so hypo
or
panhypopituitarism? Panhypopituitarism, you mean?
leading to prolectinoma, or I can keep MEN1 as well.
Men, okay. How to investigate this patient?
I would like to do investigations in form of complete blood count, kidney functions, inflammatory markers. Specifically, I would like to do an MRI brain in this patient with the pituitary protocol. I would like to do
Okay.
a complete pituitary screening panel in this patient, including growth hormone, ACTH, TSH, and I would like to check for the FSH, LH, estrogen, testosterone level, prolactin levels in this patient as well. For complications, I would like to do an X-ray, ECG, echo, bone scan, including DEXA scan in this patient as well. I would like to do an ultrasound whole abdomen in this patient as well, and complete urine routine examination in this patient as well, and serum calcium, phosphate, and PTH levels as well in this patient.
Okay, how to confirm the acromegaly as blood test, not as MRI?
I would like to go for an IGF-1 levels as well, and serial OGTT levels with growth hormone serial
Okay.
testing.
Okay. What else? What else for complications? I mean,
Like for complications, ECG, echo, bone scan, and
yeah,
a
already.
colonoscopy.
Yes.
Colonoscopy can be done for colorectal polyps or colorectal CAs could be one of the for complications, and
Okay.
for
For this
OSA,
lady.
polysomnography done can be done for obstructive sleep apnea, and for carpal tunnel, EMG and CS studies can be done.
Okay. How to treat this patient?
So I would like to educate, counsel, and do the explanation to the patient. I would like to make a multidisciplinary team, which will include an endocrinologist, neurosurgeon, and specialized nurses. I would like to admit her, and the definitive treatment will be transfemoral surgery in this patient and lifestyle modification, dietary
Okay.
modifications, and medic bracelets and other and weight reduction therapies and all that will be the part of management.
Okay, what's about medical? We
Medically,
have
yes, medically we can start patient on somatostatin analogs like octreotide. Other are growth hormone antagonists like pegvisomab can be given as well, and other like dopamine agonists in form of bromocriptine and carborgolene can be one of the options
okay.
as well.
Okay. Does radiotherapy has role here?
If after transfemoral surgery and there is a recurrence, then we can plan for the medications and radiotherapy if it reoccurs.
What else?
But I don't. I only know this.
Okay. Okay,
Yeah,
thank you.
thank you.
Okay, thank you, Dr. Sarah. Well done, Dr. Minam. Dr. Sarah, can you comment now? Start by the last question. What other indication of radio?
If the patient is unoperable for surgery, after surgery, as Dr. Minam said, and if the surgery is contraindication, uh, this is the indication for
Okay, so
radiotherapy.
prior to surgery or contraindication to surgery, right?
Oh, or the patient is
Or
unoperable for
unoperable, yes. Or after
operable, yes.
failure.
Yes, or
Surgical
after
done and failure.
recurrence.
Yes.
Yes,
Okay.
recurrence. Yeah.
Okay, can you comment now on the case and Dr. Minam performance?
Very well done, Doctora. You catch the case early and
Thank you.
you ask about it and all about the complications. But for some comments, you said men as one of the differential, yeah? Very good differential. But did you ask about in the history to exclude the men?
I tried to ask for hyperparathyroidism for joint pain or like hard
No,
stools or sorry.
there is yeah also polydipsia, polyuria. Also, this is can
Hmm.
be one of the. Okay, what
Hmm.
else you should ask in the history also?
I think like for any water brush, I ask for tummy discomfort. Any water brush, any acid brush for any
You know,
Zollinger Ellison or gastrinoma, and
yeah,
for insulinoma, I didn't ask for any sweating or any hunger pangs. That should be asked as well.
yeah. Also, you ask tummy pain as a general, but you didn't ask for sure if any heartburn or this is more specific
Yeah,
or
I'm telling like
epigastric.
for water brush. Yeah.
Oh. Insulinum also I didn't ask about anything, but yeah, it's good differential for you. Also, hypothyroidism, one of the differential. Prolactinoma, you ask about everything and you exclude it. Okay. Obstructive sleep apnea also ask about the question and you catch it. Regarding the examination, you start directly to examine the carpal tunnel syndrome, prior sign, and inverted Bryan sign, and this maybe will be uh, harmful for the patient. Maybe he will just shout, it's painful or something. So you should ask the examiner before, should I do it? If he said okay, ask the patient request and then do it because maybe it will affect your welfare. Okay. Um, that's it. The differential diagnosis you get a very good differential. Beside hypothyroidism, don't forget. And the management, it's okay. Investigation also okay. Examination also is okay. Very good.
Okay, thank you, Dr. Sarah, for the case. I will ask Dr. Minam some question. What if this patient is min 1?
Yes, sir.
Plus the history and the symptoms. How you can confirm the diagnosis?
So men is a cluster of syndromes. So like I should be ruling out hyperparathyroidism in this patient. I could not find any signs. I should be thinking about cranial diabetes insipidus. There was no problem with the waterworks, which I tried to rule out. in the bowel wall. Other than that, so Zollinger Ellison, I missed the question for any acid brush or heartburn. Insulinoma can be there, acromegaly, prolactinoma, and so through
Okay,
this
one
way,
by
I will
one.
try to.
One by one
Okay.
as investigation. How to investigate for parathyroid adenoma.
Okay, for parathyroid adenoma, I would like to go for a serum calcium, serum PTH levels, and phosphate levels, and I would like to go for an ultrasound neck in this patient as well. Then for prolactinoma, serum prolactin levels, and also MRI brain with pituitary screening. For insulinoma, we can go for C-peptide insulin levels as well, and CT scan abdomen. We can plan for that as well, and we can see for urine analysis as well. For Zollinger-Ellison syndrome, we can go for serum gastrin levels as well, and serum gastrin levels as well, and pH monitoring can be done. Uh, uh, um, for diabetes insipidus in form of cranial diabetes insipidus, we can go for similarly an MRI brain also with urinary and serum osmolarities in this patient as well. Sodium can be seen as well, and
Why you mentioned diabetes insipidus?
cranial diabetes insipidus can be a part of MEN1.
You mean a complication?
No, is a part of cluster of MEN1. Cranial diabetes insipidus.
Okay, how common is it?
Not that maybe, but it's a part, so I just mentioned so.
Parathyroid, pituitary, and the pancreas. What other type of
Hmm.
pancreatic adenoma you know?
Uh, it could be carcinoid can be, and it could be gastrinoma
Okay, what
as well,
else?
and it could be insulinoma I mentioned,
One
and
more, vipoma.
insulinoma gastrin
Do you think vipoma is
vipoma.
one?
Yes, sir, vipoma.
Okay. What else? Yes, I will comment now. I think you are rushing a lot of questions at once. This is very important comment. You try to ask a lot of questions at once. Okay, this is it will be against you and the clinical communication. Plus, the surrogate will not answer all your questions once.
Mm.
So he will answer you the last question, but the old question previously or the prior, he will ignore it. So try to ask one by one. Calm down. You are so fast. Yeah, you are trying to ask a lot of questions. You got the case, but still you miss the parathyroid. However, you are asking very fast. Just calm down. Maybe because of stress at the first time, but I think with the time you can do it professionally. And the systemic view, try to ask them as organized way. Don't ask haphazard question or random question. Okay. If you want to confirm complication, you can do it while taking the system review. For example, this patient acromegaly, obviously, as you said, change of the facial features. You asked the question was the diagnostic question. This is acromegaly. Be sure that he will not give you isolated acromegaly in the exam, either acromegaly with complication like hypertension, obstructive sleep apnea, osteoarthritis, or carpal tunnel, as you mentioned, or it will be part of main one. And again, it will be you have to roll out or to include the other question related to the other items of main one. Clear? If it comes as isolated, it's okay, but you have to roll out the association and be ready to put the differential of both of them, main one along with acromegaly, or you can say other complication as you mentioned. Okay, acromegaly complicated by OSA or hypertension, hyperglycemia, whatever. Okay, Dr. Minam. Otherwise, you do great. The questions to the point, the investigation, the image, even the question are good. But again, please take a breath before asking the question. You're rushing the
Okay,
questions.
sir.
Okay.
Okay, sir.
Okay. And the differential also was good. The examination steps was okay. Proximal mammoth you didn't miss, which is very perfect. The other finding in the hand you didn't miss as well. In the brain, the visual field, and the heart examination. Did you do the examination of the heart?
Yes, sir.
Yeah. What do you think the heart will be? Any cardiovascular manifestation will be here?
Yes, sir. Cardiomyopathies can be there.
Cardiomyopathy
Dilated
and yeah,
and
high output failure, right?
yes, high output cardiac failure.
Yeah. So you might have the displaced apex, or you might have hypertension and the complication of hypertension on the heart. ECG, echo. Don't forget to mention them in the investigation for the complication
Yes,
as well.
yeah,
You
I
mentioned,
mentioned,
right?
sir.
Yeah,
Yes, sir.
perfect. Yes, otherwise, great, Dr. Minam, as a first time. Just calm down and try to slow down your question. We always advise to speed up, but mashallah, you are asking quickly. So the advice will be the opposite. Try to slow down your questions and
Okay, sir.
wait for the surrogate to talk. Sometimes you are interrupting her. She's talking and you are asking the next question. You are not giving her the chance to speak or to give you the answer. Okay?
Yes, sir.
Sometimes she want to say, or the surrogate want to say something to help you to diagnose. It's not only question he has to answer. No, sometimes he has instruction to follow. He will tell you something you should know or you should hear, and you will build your diagnosis on this information. Clear? Okay, thank you,
Yes,
Dr.
sir.
Minam. Well done. Let's read the discussion or open the discussion, but please give the scenario to Dr. Sarah.
Okay, sir.
Yes, okay, let's read the comments. Great, Dr. Yeah, Dr. Henry. Well done. You started before even you give a good differential. Cushing, myasthenia gravis, Addison, polycystic ovarian, hypothyroidism, acromegaly, and it was one of them, the acromegaly. Let's make it the opposite. Tiredness with loss of weight. She mentioned the opposite, the tiredness with weight loss. Sorry, with weight gain. Let's mention the causes of tiredness along with weight loss. Anyone can answer? Okay,
Sir,
Addison disease.
sir,
yeah,
malignancies,
perfect. Yeah, on the top, yes, malignancy. So all the
infections
constitutional cause, infection, yes, all the
like
infection.
tuberculosis, HIV.
Perfect. What else? Dr.
Sir,
Henry
autoimmune,
was, yeah, yes, go ahead.
sir,
Autoimmune?
autoimmune like
Yes,
Addison's, celiac. These
perfect.
can cause, sir,
Malabsorption, yes,
or
all
sir,
malabsorption.
sir,
Perfect.
myositis
So
can
all
lead to weight
connective tissue, all connective
connect.
tissue, patient will be fatigued, sometimes loss of weight because of loss of appetite as well. So all of them. Anemia is the most important in PACEs. You will have patient with low weight loss, sometimes loss of appetite, and it causes fatigue. All types of anemia you have to talk about according to the case, right? I think Dr. Ihda, yes, she mentioned it in the second differential hypercalcemia, anemia, Addison, hypothyroidism, myasthenia gravis, OSA, obstructive apnea, acromegaly, Cushing, metabolic syndrome, polycystic ovarian. I will ask now Dr. Sarah why this patient is having, uh, I think you mentioned period change. I don't know what was. Did you ask Dr. Minam what was the period change?
Yeah, it was amenorrhea. Sometimes 3 months,
Yes,
4
sir.
months without. Yeah, she
I
asked
asked.
already.
Yes, sir.
Okay, so you have to
Some
know what type of period change. Don't say period change to the examiner. Either to say is it menorrhagia or oligomenorrhea
amenorrhea.
or
Yes.
amenorrhea. I think when you mentioned to the examiner, you said period change, right?
Yeah, actually, she said that. Yeah.
Yeah. You have to specify what type of period change. Why? Because he will ask you what you mean by a period change and what's the relation between period change to the case. Did you ask about the intimacy?
Yes, she did. She did
Yes,
already.
yes,
Yes.
sir.
Intimacy itself.
Intimacy.
What do you think the cause of the loss of intimacy or the loss of the desire, Dr. Minam?
Sir, hormonal imbalance would be one of the reasons. There will be more steroidal, I think, in the patient. Maybe.
Let's say hormonal deficiency, right? Because of some
Mm.
of the pituitary itself deficiency, so it might compress other on the other parts of the pituitary. So the other hormone might be suppressed or in insufficiency. Okay, what other cause can what other reason can cause a libido or decreased libido or impotence in such patients, either female or male?
You mean in acromegaly or in general? Or pituitary
Acromegaly.
tumors?
No, acromegaly will be related to acromegaly per se.
Beside the hormonal
Apart from
disturbance?
hormonal, yes. Hormonal means something primary from the hormones.
Insulin, increase the insulin resistance or what?
No, no. Something as a complication to a complication.
Sir, hypogonadism.
Macroadenoma,
Sorry, not hypogonadism.
Hypo.
What? No, not hypogonadism. Someone mentioned? Yes, doctor?
non-functional macroadenoma,
Compression of the stalk, pituitary
Yeah, the
stalk,
compression will already will.
dopamine. Yeah.
No, no, no. You mean the prolactin? No. Again, it's not hormonal part due to the fatigue itself, and the fatigue due to complication because of gain weight or weight gain. It's very important. One of the complication of OSA, the patient will have sleepiness along with the headache, feeling unrefreshed, sorry, osteoarthritis, and impotence. He doesn't have the desire or he lost the libido because of the obstructive sleep apnea itself, the fatigue. Okay,
Mhm.
this is another pathway or other pathology of the loss of desire. So you can ask it as a question related to hormones or as a complication or consequence of the obstructive sleep apnea. He will tell you
Okay.
yes, doctor. Okay, and both male and females. Okay. Yes, obstructive sleep apnea. Someone wrote it, Dr. Huda. Yeah, well done, Dr. Huda. Prolactinoma, not only prolactinoma, even the compression on the gonadotrophic part in the pituitary can cause it. So the patient will have loss of FSH, LH, or gonadotrophic releasing hormone. Okay, that's why this patient also is having amenorrhea, either due to prolactinoma or loss of gonadotrophic or decreased gonadotrophic hormone. Okay.
So,
Uh,
sir, non-functioning pituitary adenoma can be one of the differential as well.
yes, perfect. It can be.
Mm.
Okay, but men, you should roll it out and put it in the differential. Whenever any candidate or any doctor has acromegaly case, please don't stop there. It's a tricky thing. There is something hidden. Either acromegaly complicated, obstructive apnea, headache, pituitary macroadenoma, hypertension, hyperglycemia. Not only that, you have to rule out the component of main one. Okay, so this is always advice. Anything clear to you as a spot diagnosis, it's a tricky case. You have patient with vitiligo, skin rash, and you notice this is vitiligo. It's not a vitiligo case. You will have other component of something hidden, autoimmune, I think. I mean autoimmune in the form of celiac, thyroid, diabetes, Addison. Okay, it's not a matter of spot diagnosis case. Okay, Dr. Minam, your case, sorry, Dr. Sarah, 40 years old male with arthralgia. Let's assume he is Smith. Smith, 40 years old, presented with arthralgia. Dr. Minam asked, OSA will cause libido loss. You mean yes? Yes, loss of libido. Okay, in both male and female. She missed axilla. Well done. I like the negative feedback because no one, negative feedback always help to improve. But the positive feedback, you will feel, yes, I am satisfied with my performance. Whenever anyone, I miss the comment or part of the examination, please mention it to the candidate or to the participant to have it in the next performance. Okay, she missed axilla examination to look for acanthus nigricans and skin tags. Not only the axilla, even the back, shoulder, and the neck. The activity also of acromegaly, she should examine. Hypertension, did you ask for blood pressure, Dr. Minam, and vitals?
Yes, sir. Yes, sir.
Okay.
Blood pressure and pulse
So
I
what
asked.
are the activity or the signs of activity of acromegaly?
Sir, skin tags
Okay.
and OSA,
No.
high blood pressure,
Okay. Hypertension and something in the hand, in the palm.
sweaty palms.
Yes, sweaty. Did you ask for or did you examine it?
Yes, yes, sir.
Yeah, always examine the palm and the dorsum. Don't examine the one side only. Sweating in some disease, you have to check hyperparathyroidism, pheochromocytoma, acromegaly. Okay. And the opposite, in the hypothyroidism, you will have dry hand, loss of hair, and the pulse. Of course, you have to examine in all these conditions. The pulse here, what do you think the pulse will be? Dr. Minam, we are ready for, we are waiting for you to start, okay? Whenever
Sir,
you are.
pulse will be
Sorry,
a
Dr.
pulse
Sarah.
in this case, sir. Pulse will be tachycardic in this case.
Okay,
Why,
can we start?
why tachycardic? Okay, I will finish this question, then we can start. Why tachycardic? I mentioned it a while ago. What type of pulse you might have in this patient?
High volume, Dr. Dr.
Exactly.
Yeah,
I
yeah.
said a while ago, high output failure, right?
Yes, sir. So,
So the volume will be, or the pulse will be hyperdynamic or high volume pulse.
yes, sir.
Don't forget it. Okay. Yes. What else? Any other comment before starting? Sweating. Yes. Thank you, Dr. Khalid and Dr. Muhammad Omar. Perfect. Ready, Dr. Sarah?
Okay.
Yes. As usual, others, please write your differential of arthralgia in this age group, 40 years, a male patient. Here you go, Dr. Sarah.
Hello, I'm the doctor in the service today. Is this Mr. Smith, 40 years old?
Yes, doctor.
Hi, Mr. Smith. How are you?
I'm good.
So, Mr. Smith, we are here to discuss about your health condition. Is this okay with you?
Yes, doctor.
I will ask you some question, examine you, and then address your concern. Okay?
Yes, doctor.
So, Mr. Smith, can you tell me what brought you here today?
So, doctor, I have been having these body pain for almost a week, and I don't know. It started suddenly, and I don't know what has happened actually.
Which one exactly?
It's in my whole body, doctor.
Whole body. You mean
Yes,
the
doctor.
joint of whole body or the bone itself?
I cannot differentiate, but I feel my joints are painful too, and my
Uh,
muscles sometimes as well.
so it's more in upper or lower, يعني you mean in feet, on hands, where?
Like in my legs, in my hands, in my back, it's all over.
It's all over. So
Yeah.
it's since 1 week and it's sudden.
Yes, doctor.
Before it was okay, nothing of this.
Nothing previous happened, doctor.
First time for you.
Yes, doctor.
So do you notice anything that increase this pain you feel?
Doctor, like I feel tired as well. So I
Tired.
feel like resting. So any activity, like I'm tired as well.
Okay. Um, I mean, you notice something increase this?
Doctor, it's the same. Like I can't do much activities as I'm tired, as there is pain. So I most of the time like
Mm.
sitting, resting. This is like
So by sitting and resting, you feel it's better, improved.
it's not improved, but I cannot do much activities. I feel tired and I have pain. That is why pain is still there.
Okay. Okay, I understand. Sorry
Mm.
for that. For with this tiredness and feel pain everywhere, do you notice any high body temperature?
Doctor, I have had high body temperature 10 days back.
High body temperature since how long?
I had 10 days back. I had a sore throat. Then I
10 days.
had a high body temperature.
Okay. And this high body temperature still till now, or it's improved?
No, no, doctor. I have nothing now.
It's improved. You take any
Yes,
medication? You take any advice or take
yes,
any medication?
yes, doctor. Doctor gave me some paracetamol and some penicillin as well. So I got better.
Okay. Did you notice any change in your body weight that increase or there is any swelling around eyes?
No, doctor.
But nobody changed.
No,
No headache.
no, doctor.
No skin rash anywhere.
No, doctor.
Okay. Do you have any medical condition? Should be aware about it.
No, doctor.
So regarding this sore throat, it's improved completely,
Yes, doctor. It was a mild pain in my throat.
and now nothing. No fever, no sore throat.
No, doctor.
Okay, understand. So I will ask you some question. Do you have any headache,
No, doctor.
blurred of vision?
No, doctor.
Do you have any numbness feeling anywhere or
No,
weakness?
doctor. No,
Weakness?
doctor. No, doctor.
Okay. Do you have any neck swelling?
No, doctor.
Okay. Do you have any chest pain?
No, doctor.
Any awareness of your heart beating?
I didn't notice, doctor.
Do you have any short of breath?
No, doctor.
Cough?
No,
Coughing of blood?
no, doctor.
So do you have any difficulty of swallowing?
No, doctor.
Do you notice any tummy pain or heartburn?
Doctor, you can say that I have mild tummy discomfort. Mild.
Wh- Where exactly?
In my flanks, doctor.
In your flanks. Okay.
Hmm.
Since how long?
Maybe at the same time, doctor.
1 week.
Yes, doctor.
Okay. Do you notice any change in your water work?
Doctor, my water work has been reduced.
Reduced.
Yes.
Okay. And color?
Color, doctor, it's the same, I think.
No change. Did
Not
you notice
much.
it's like fruity,
Not frothy. Maybe you can say a little dark, but not frothy.
but not change like red, like tea
No,
color,
no,
like this?
no.
Yeah, just the amount. Okay,
Yes,
understand.
doctor.
Okay, so do you have any change in your bowel habits? also?
Mm, no.
Bleeding?
No.
I mean bleeding with back passage, stool passage.
No, doctor.
Okay. Do you have any feeling of thirst most of time and want to drink and want to go to for water work?
Drink a lot of water, you mean?
Yeah, you feel thirst
Doctor,
sensation. I mean,
I'm taking normal as usual.
no change.
No.
Okay. Do you feel dizziness while standing, or
No.
you didn't notice any tinnitus in your ear?
No, I didn't notice, doctor.
Okay, okay. Um, you said you didn't have any previous medical condition. No medicine you take? Show me your medication
Doc,
list.
I just mentioned, doctor, these medication I took, and other than that, just maybe some vitamins before that, but not any no regular medication.
Okay. Do you have any surgery before? Did you do any surgery
No.
before?
No, doctor.
Sorry for that. Are you taking any illicit drug?
No, doctor.
Sorry also for that. No needle shearing or something?
No, doctor.
Okay. So, Mr. Smith, I want to ask you some personal question. Are you a smoker?
No, doctor.
What about alcohol?
Occasionally, doctor.
Occasionally. Okay. What do you do for a living?
I'm a teacher, doctor.
And how this condition affecting you?
Yes, doctor, for 1 week, I have been very tired. I'm not going to attend the classes, and the water work has reduced. The tiredness is all the time. So it's quite difficult, and I'm worrisome as well.
I'm s- I'm so sorry for that. If you need, I will give you a sick leave, and I will offer for you referral to the occupational health care if you want. Is that okay with you?
Thank you, doctor.
Okay, then I want to examine this patient.
Okay,
About
doctor.
general look, if there is any specific in the general look, did he has any puffiness in her face, around the eyes?
No, doctor. No.
Okay, from hands, we will start from hands. Any change in the
Mhm.
hands? Any clubbing,
No,
any splinter hemorrhage?
no,
The palm, if there is any pallor or something, palmar
no.
erythema, nothing. Pulse, normal, regular,
Pulse, yes, normal.
good volume.
Yes, good volume.
Okay, what about blood pressure?
Temperature?
Blood pressure,
Blood pressure is 110 over 70.
110?
Over 70.
110 over 70, okay. So to the face, there is any pallor or jaundice in the eyes?
Negative.
No malar rash or something in the face?
No,
Oral cavity? No, nothing, no cyanosis, no gingival abnormality,
negative.
no ulcers.
No,
Okay, I will examine the neck. There is no neck swelling.
no,
Thyroid not palpable.
no.
Okay, I will examine the abdomen. Inspection and notice tension.
Noticed mild tenderness in the lower tummy or like in the flanks. Mild tenderness.
Bilateral or
Yes, it's by little mild tenderness when you just do the deep palpation.
okay, bilateral, uh, but not palpable kidneys, just
No, no.
tenderness.
Yes,
Okay, any other organomegaly?
negative.
Negative. Okay, what's about lower limb? Any edema?
No.
No. And the joint?
They when you like press, there is pain. He is feeling like they are when you are touching, like there is pain.
Uh, all the joint?
Yeah, you can say.
So there is any joint swelling in the upper limb, in the hands?
No, no,
the just tenderness over the joint itself or over the bone?
It's like just tenderness. Just tenderness. You
Where?
cannot see any it's like muscle tenderness. Like when you
Muscle?
just press any part, like you touching a bone, or that's just, it's like he feels pain, but there is no skin changes, no hotness, no vomit, no cellulitis, nothing.
Okay. So no changes, just tenderness while I'm touching, you mean?
Yeah.
Okay, I can understand. Okay, nothing else. So Mr. Smith, can you tell me what's your concern, please?
So doctor, what's happening and how will you treat me?
I highly appreciate your concern, Mr. Smith, and I know how it's difficult for you. For regarding this, your health condition you came with. It's most probably due to your previous infection, that sore throat. You feel it or you experienced 10 days ago. Sometimes after getting this infection by some viruses, sometimes we experience after that a condition, what it's called post-infection syndrome. So regarding this, we will just run for you some blood tests to rule out other may complicated disease, and we will just give you some supportive treatment. It can be called, like we will give you something to relieve this symptoms with you. Is this okay with you?
Yes, doctor.
So do you have any other concern?
So doctor, will you admit me?
Regarding this, we will at the beginning start to send for you some blood tests and
2 minutes
some
left.
urine tests also, and scanning if needed. And after that, we will decide it according to your blood result. But most probably, you will not need any admission.
Okay, doctor.
Do you have any other concern?
No, doctor. Thank you.
Okay, thank you.
You want to examine or to ask more history? Anything
Actually,
left?
I think everything I ask, it's negative.
Okay.
Uh,
So you want to start examine question, right? Let's
okay.
start. Yes, Dr. Milan, please.
Okay. So what are your differential, please?
I will present my case first or start the
Okay.
differential. I just examined this gentleman, 40 years old, Mr. Smith. He just came with feeling tiredness, fatigue, and arthralgia all over the body since 1 week, and it starts suddenly after getting sore throat 10 days ago. Regarding examination, there was just generalized tenderness all over the body, also generalized bilateral line tenderness. Other than that, I couldn't appreciate any other symptoms or signs.
Okay.
Okay.
Okay. So what are your differential?
Okay, my first differential for this patient is a post infection syndrome. Most probably due to sore throat and viral infection happened maybe 10 days ago. My other differential will be IgA nephropathy. But against this, there is no hematuria, and the attack will start 2 to 3 days after the infection of sore throat, or it's a post-streptococcal glomerulonephritis. Also against this, it's there is no hematuria. Blood pressure was normal. No symptoms of nephritis with this patient, even with history or examination. So, but this is my 3 top differential.
Okay. How will you investigate and do the management?
Beside basic investigation, what it's CBC, CRB, SR, renal function, and liver function. Renal function will order urea creatinine and electrolyte also, and urine analysis also. We will check if there is any blood in urine and if there is also protein. And we may need 24-hour urine for protein or albumin creatine ratio also. I will order also ultrasound for the abdomen. And that's it.
Okay.
If there is any sign or of any blood test shows that maybe there is a possibility of nephritis, I will just do a renal biopsy to confirm.
Okay. How will you manage?
Beside treatment or management for this patient will be non-pharmacological and pharmacological. Non-pharmacological patient education counseling and so occupational and social support if needed. Pharmacological, if it's according to the diagnosis, if it's just a post-infectional syndrome, it will be just supportive treatment. Regarding to supportive, no specific treatment. But if it's nephritis, it's according to type of nephritis. Maybe we need steroid for this patient and then steroid sparing agent.
Okay.
You're done with the
Okay.
question, Dr. Mina?
Sir, yes.
Okay, I will ask her more. She managed
Sorry.
the patient. If you don't have
Sir,
questions, yeah, you can ask if you have some questions. Dr. Minam, you can continue asking. Still 1 minute
Sir,
left.
okay. How will you differentiate arthralgia from arthritis?
Perfect.
How? Please again.
How will you differentiate arthralgia from arthritis? Like this patient has arthralgia, right?
This patient has body pain, as you mentioned. Bone and joint all are in pain.
Yeah,
Not only the joint.
arthralgia.
Yeah, arthralgia, it means joint pain, but just only pain, no swelling, no redness, no inflammatory signs. But arthritis, it's inflammatory process. You will find swelling, redness, hotness, and limitation of movement also, and stiffness if it's also. Okay, what else?
Any other differential you would like to think?
Reactive arthritis. Reactive arthritis could be, but it's in short duration. Just you said 10 days ago have sore throat, and it's even the reactive arthritis also it's maybe because of after diarrhea or after sexually transmitted disease, not after sore throat usually. And there is other signs like eye signs or and you can't see, can't be, and can't climb the tree. I mean, there is arthritis, uveitis, and arthritis, conjunctivitis, and urethritis. But it's not here. What can be one of the differential? Okay.
Okay, sir.
Yes, Dr. Minam, finish?
Yes, so
okay, what
that
image? Yeah, one question I will ask here. What image and what complication you expect this patient will have in the future?
Actually, I didn't get the diagnosis.
Okay, let's assume, I'm not sure also, but let's assume this is post-streptococcal. Yeah. What specific investigation?
I already said that for post-streptococcal, okay, there is complement markers, also C3, C4 will be low.
Perfect, yes.
And ultrasound for sure, and we need ultrasound guiding or CT guiding biopsy for this also.
And what was specific to expect the affection in the future?
I didn't get the question.
There is specific
you mean
marker
the
and
complication?
There is titer you have to do. What's called?
I don't know actually.
And septolysin O, right?
Yeah.
Okay. And what complication might happen? Yes, tell me. If in the developing countries.
This post-streptococcal may go to rapidly progressive glomerulonephritis, so it may end up with renal failure.
Perfect. And
I don't know,
for the
renal
long term,
complication of renal failure.
other renal, and apart from the renal as an organ, what other organs can be affected? I told you, particularly in developing countries.
Heart, you mean?
Exactly.
Heart.
Yes. Yeah.
Rheumatic
So
heart
it will.
disease.
Yes. Yes. Perfect.
Yeah,
You have to be.
but this is the complication of streptococcal bacteria
Yes, I'm
itself, not
talking.
the post. Oh.
So it might migrate here or there.
You
The
mean
kidney.
I understand you. It's what the complication of post streptococcal. I mean the disease itself,
No, no,
not
you
the
talk already
bacteria.
about the kidney. I'm talking
Okay, the
about.
bacteria. Yeah, the bacteria
Yeah.
also there is in
Yeah.
joint also.
Yeah.
Rheumatic fever and rheumatic heart disease and post
Perfect.
streptococcal glomerulonephritis.
Okay. And I think, yeah, 8 minutes, that's enough. Dr. Mina, can please, Mina, you can comment,
Yes.
then I will.
What is the case?
So, sir, this is a case of acute IN, acute interstitial nephritis, and penicillin was the offender basically that lead to this acute. So this case has came in UK 2 times, acute interstitial nephritis. So it was also asked that what you will you see in the urine cast, so WBC and eosinophil, and what is the
Eosinophil,
treatment? Yeah, and
yeah.
the treatment is like removing the agent if he's taking, or like hydration, and if not, then accordingly. So acute interstitial nephritis, fever, arthralgia, and any offending agent and leading to AKI.
But
And
the patient
rash,
has no
Then
fever now,
post
yeah?
strepto,
some rash,
so
right?
post streptococcal can be one of the, yes, sir, can be.
Yeah, interstitial nephritis will be present with rash as well, right?
It's hypersensitivity to drugs
Yeah.
mostly.
Yeah, so
But I think you shouldn't.
so
I asked about rash. You said no rash, and you said the fever improved already.
Yes. Maybe
So
on
it's
the
tricky,
exposure
actually.
only. It's okay. We
yes,
are
sir.
learning. It's good not
So
to catch the case, to know it. But if you catch the
Yeah.
case, you will
yeah,
forget
so
it.
actually,
Yeah.
so rash was not given when we did the case. So
No
only
problem, no
penicillin was
problem.
given,
I'm
and
just
at that,
reminding. I'm
yeah.
talking about the topic itself. Was there a rash in the diagnosis? I think there
Mm,
was triad of fever, rash, and uh,
Arthralgia. Yeah.
arthralgia. Yes.
Dr. Minam, so the case came in UK like this, arthralgia with no other signs at all? No rash, fever
yeah,
improved
it
and
was the,
everything?
yeah, that they were, yeah, rash was not given in the history because like I presented the case, and it was a history of fever 7 days back. He was taking penicillin, not
But
currently. Then he got arthralgia, urine output was reduced. It was not hematuria. He had severe arthralgias, weakness, fatigue was there. So this was kind. So only they given
so,
penicillin as a hint. So nothing was there.
okay, so
No
the
rash.
only arthralgia, no rash and no fever now,
No, like
improved already.
maybe patient has given no, no rash. I specifically like asked for that. So there was no rash in the patient.
But this is difficult to catch it, actually.
It's okay. We are learning, and I think we.
I mean in the real exam, if it's like this,
No, no.
everything negative.
At least, Doctor Sarah, you mentioned the reaction on the kidney. So something in the kidney. It's you might miss even the kidney as a kidney affection or as a
Yeah.
response. And by the way, the glomerulonephritis is differential to interstitial nephritis.
Yes, sir. Yes, sir.
Yeah, you might gain some marks. You will not lose the
I
case. Maybe.
I mean,
Yes, sir.
if in real exam they will just bring like this one sign or one symptoms and just there is simple
No,
hint,
I
and
think
I
yeah.
think it's
Suppose
difficult.
yeah. Supposed to give more clues about the case, but again, we are learning to put it as a
Hello?
differential.
Okay.
Dice,
Sorry, we will mute this. Okay, sorry for this. Back to the
Hello.
case. Yes, we can hear
Okay.
now. Okay, Dr. Sarah, I will ask you now again after we catch the case. What are the investigation here?
Okay. So for the investigation for this patient, we should when I send urine analysis, I will check the eosinophiluria because it's the most hallmarking or pathognomic for this interstitial nephritis. Also, you can find eosinophilia in the blood. Um, okay, beside the other
Perfect.
regular,
Yes.
yeah. Here we need to check the eosinophiluria for
Yeah,
this
this is
patient.
this is the specific investigation here. The urine and the blood is xenophilia.
Yes.
And I think ultrasound will not show you anything. The
Yeah.
reaction interstitial only between the glomeruli than the tubules, so you cannot see it. But the effect will be already resolved because of stopping the offending medication.
Yeah, but the definitive, if we need to check definitive, it will be for sure biopsy.
Yes, if it's still persistent, you can do renal
Yes,
biopsy. Yes.
yes.
And so it's the diagnosis now changed from post-streptococcal
To
to interstitial due to
interstitial.
penicillin. Yeah.
Yeah. So the
But still,
penicillin.
both of them are differential. You can put it
Yeah.
as differential.
Okay, this case we will not forget because
Yeah.
it was tricky.
Yes. And the medicine will not finish. Every day we learn a case, really.
Okay.
And the interstitial, we didn't do it before, interstitial nephritis.
Because I
As
thought it's just simple topic, nobody will give in
yeah, yeah.
long.
Imagine it's so easy. Just one clue, penicillin and infection. But I think the diagnosis you mentioned to the patient as a concern, you can gain good mark. It's post-infection reaction. And this has happened. After the infection, he had this thing. For the examiner, he might minus you regarding the diagnosis itself. But still you got good differential and he can give you some marks on the discussion because you mentioned most of the investigation related to both condition. Okay.
Okay. Okay.
However, eosinophilia is supposed to be specific here, but at least you mentioned the blood and the urine analysis. It will be showing. What about glomerulitis? What urine analysis will show you in the glomerulitis? Post
You mean this?
streptococcal. Yeah.
It will be cast mainly.
What cast you have?
RBC's cast.
Perfect. And dysmorphic blood
Yes.
cells. Yeah, this is the difference, main difference between the interstitial as the eosinophilia or granulocyte cast. Here you will have, or white blood cell cast. Here you will have blood cast. Yeah, thank you, Dr. Minam. Nice case as a new one. And also the performance was good. Dr. Minam, you have any
Thank you
question?
so
Or Dr. Sarah?
Thank you so much.
much.
Yeah, so the treatment, we agree, stop the medication. If you want to further investigation, you can do renal biopsy. However, the eosinophilia can be diagnostic. The other differential, let's repeat the differential. Interstitial nephritis, post-streptococcal nephritis, glomerulitis, or,
IgA also I mentioned.
yeah, and against IgA,
The duration itself, and also
yeah,
there is no
2 days
hematuria.
or less. And the blood, the IgA, what you will see in the urine analysis of IgA nephropathy?
Urine analysis, hematuria will be
Exactly. What we call it? What type of hematuria?
M- Microscopic.
No,
macro.
Macroscopic.
macro. Yes,
Macro.
this
It
is,
will be, yeah, macro.
yeah, it's macro. Gross hematuria, okay? And IgA as a protein or nephrotic wise disease, it would be the IgA.
You mean in the biopsy or in the
No,
in the
no.
blood?
The is it nephrotic or nephrotic?
Nephritic.
Nephritic, yes.
Yes.
IgA is nephritic because gross hematuria. And
Yes.
post-glomerulitis,
Uh,
post-streptococcal,
nephritic also,
mixed.
but
Mixed.
mainly nephritic mainly.
Mainly nephritic, but mixed.
Yeah, could be mixed, but mainly.
And the last one, interstitial nephritis. I think
Um,
this is not
yeah,
related to
yeah, it's not.
protein because
Yeah,
in
No,
the,
sir.
yeah,
Yes,
yeah,
sir.
it's
interstitial,
not
yeah,
glomerular. It's just
yeah, it's,
interstitial.
yeah, interstitial, so it will not show any protein in urine.
Yes, sir.
Yes, yeah,
Yes.
perfect. Yes, it's a good case. Thank you, Dr. Minam, to remind this topic because no one do it before.
Actually, I was thinking before, is this renal system is important. Did anybody ask about it?
Yes, it's important, of
Yeah.
course.
No, I mean, usually they are asking about endocrine, about,
Okay,
I
but
mean,
yeah,
rheumatology, about
some
like this, but
centers, some diets, you might have one case in every diet, so it might be there. Okay,
yeah.
don't miss it at all. At least know the
No, no, I
basics.
don't mean that, but I mean it's not that much
Not
important
common.
because nobody,
Yes,
yeah,
you're
not
right.
common.
Not common as the rheumatology or the
Endocrine,
endocrinology or renal itself as the endocrinology again, fucorymocytoma and the suprarenal gland. But the renal itself, it's not common. But again, put as only highlights about our headlines of the topic itself. Both streptococcal as a differential, interstitial, you can read about it once
yes.
only. Our case today is, yeah, I think you will not forget it again, Dr. Sar.
Inshallah, no.
Yes. Other case, I don't think it's very common, apart from polycystic kidney.
Polycystic kidney.
And the transplant, the reaction, the post-transplant failure, the rejection, everything you can discuss. But as a glomerulitis, yes, you can mention it as a cause of renal failure in young patient after the diabetes and hypertension.
Okay,
And of course, polycystic kidney disease,
okay.
if you have the evidence of it.
Yeah,
Okay.
sure.
Yeah,
Okay,
but worldwide, the most common is diabetic.
okay.
Okay. Thank you, Dr. Minam and Dr. Sarah. Any other question or comment
Thank
anyone
you.
want to add?
Thank you, sir.
Thank you, doctor.
Yeah, we will look now at the chat box. Anyone wrote this differential, he deserve a gift because it's unexpected at all. Let's start from Dr. Henry. Perfect. Hemochromatosis, agree. It's in young patients as it is one of the autosomal recessive inherited condition. Rheumatoid arthritis, definitely you're right. Gout, absolutely right. Psoriatic arthritis, pseudogout, SLE, ankylosing irritable inflammatory bowel disease, spondyloarthropathy. I agree, but it will be more axial, not peripheral. The Takayasu, okay, polymyalgia rheumatica, stiffness, not in the hand. What was the complicated? It's only arthralgia, so it's not stiffness. Anyway, ankylosing, okay, rheumatic heart disease, post-infectious glomerular. The last one as second differential. Perfect to mention, Dr. Henry. Sarcoidosis, Dr. Musa, okay, mm, little far away, but at least you know there's joint pain affection in the sarcoidosis. Don't forget it. Vasculitis, polymyalgia rheumatica, Dr. Ihda, osteoarthritis, rheumatoid, gout, hemochromatosis, reactive arthritis, perfect. Little bit related as an infection and post-infection reaction, inflammatory bowel disease, diverticulitis, post-viral fatigue syndrome, fibromyalgia. Okay, Gabriel, Dr. Gabriel, post-streptococcal, IgA, hemolytic uremic syndrome. No one mentioned it at all. Polymyalgia rheumatica, fibromyalgia, glomerulitis, rheumatic heart failure, anti-sortator, rheumatic heart disease, cardiac. Yeah, Dr. Gabriel now comment on interstitial nephritis due to drugs. Presence of rash is not mandatory, agree, but it can be there. It require high index of suspicious or suspicion. Okay. Dr. Ida RBC is cast. Dr. Mansour, Dr. Ida again, great. Yes. Nice session as usual. Every day we are learning either by new participant or even the popular and the one participated before. MashaAllah, the knowledge will not end. The medicine as well.
Yes.
Yeah.
Doctor, I
So
have just question, please.
yeah, sure,
One of
sure.
them just mentioned fibromyalgia as a differential, but it's far away differential. I mean, just 1 week.
Yeah.
I
So
know fibromyalgia might take months.
yes, I always ask them to put differential before starting the practice. So they are thinking about the all possible. Later on,
Mm.
you can narrow it more and more till you have the diagnosis. It's a matter of training how to give differential. some
Okay.
doctors, unfortunately, they miss the success because of one mark in differential, for example. So please don't miss any mark.
Okay,
Differential
inshallah.
diagnosis or all skills. So to train and to make it more interactive, just have some participation during the comment chat box, and I hope the participant will not look at the chat box. So he will or she will think by her own mind. Okay. So
Yeah, sure.
anyone will do practice. Don't look at the chat box at all. Try to think, focus on your history. And by the way, Dr. Sarah, your approach is perfect. You are
Thank
covering,
you.
yeah, good in good way. Started, and this is my favorite approach to start with the complaint, then relevant, then the constitutional, past medical, and the systemic review, then the family travel. But I believe you have to ask, do you smoke? Don't say, are you smoker? Okay, do you smoke? Do you
Okay.
drink alcohol?
Okay.
Okay, and don't say, are you alcoholic? Alcoholic means the
Abuser.
yeah, so the patient is alcoholic, and the alcoholism should be with a definition. Patient is drinking and have some symptoms of alcohol toxicity. Don't say, are you a smoker? And don't say, are you alcoholic? Just do you and do you. If you want
Okay.
to ask
Okay.
about the past, yes, are you or do you or did you smoke ever before? Or did you also drink alcohol before? Otherwise, the approach was perfect, the examination as well. Okay.
Thank you. Thank
Most
you,
welcome.
doctor.
Thank you, Dr. Sarah, also. Anyone want to comment? It's open discussion now. Feel free to comment. If no comment, we can end the session. Satisfied all?
Thank you, doctor.
Okay. Thank you, Dr. Sarah, again, Dr. Minam. Thank you, everyone, for the participation and attendance. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam.